This book is written Medical Office Assistant Margaret Prudent, Registered Nurse, and Sharon Burns, Registered Nurse. Appointment and Report, Chapter 1. The material presented in this chapter will help familiarize Medical Office Assistant with two important administrative duties they may be asked to perform. The first part of the chapter will focus on appointment and scheduling. The scheduling of patient appointment is an important part of keeping the office or clinic flowing smoothly. The medical office assistant approach to this process will set the stage for the patient experience at the office or clinic. You will be introduced to various methods of scheduling appointment. The second part of the chapter will focus on report, specifically assisting the physician in producing an article or manuscript for publication in a professional journal. The medical office assistant may be asked to assist with research and or preparation of the article for publication. This section will help to familiarize you with the process. Scheduling appointments. One of the administrative duties you may be asked to perform as a medical office assistant is to schedule appointments in your office or clinic. This may sound like an easy task, but in reality it can be quite challenging. In addition to working on the schedule around the physician, you will also be juggling the schedule of working parents, school-age children, and even parents who may be relying on others to bring them to their appointment. There may be times when you feel the schedule is set, yet walk-in or emergencies occur, causing even the most planned and organized schedule to be altered. When scheduling appointments, neither in person nor over the telephone, the medical office assistant should remember to do so in a pleasant, professional manner. The impression you give a patient is an overall reflection of the office and physician for whom you work. While you strive to manage the physician's time in the most effective way possible, remember to always consider the patient's needs and concerns when scheduling appointments. How soon does the patient need to be seen? Does the severity of the patient's condition require immediate attention? A patient that calls to book an appointment for a yearly physical can wait for a time that is mutually convenient, while a patient complaining of chest pain should be seen as soon as possible. Your overall goals for the patient will be to provide an appointment time that is an acceptable waiting period given the seriousness of their medical condition, is convenient, results in a minimum wait time in the office waiting room, allows for quality time with the physician. The preference of the individual physician will also be taken into consideration. All office staff should be aware of the physician's preference for scheduling patient. An office manual is a good tool to have for front office staff. This can provide the assistant with a guide for booking preference, office policies, and procedure. The policies for booking appointments should be reviewed periodically. If a trend develops, for example, if the physician finds a specific procedure takes him 30 minutes rather than the allotted 15 minutes, then the booking process for that procedure should be reassessed. Reassessing schedule policies can aid the practice in reducing patient wait time and managing the physician and the staff time more effectively. Length of time of scheduled appointment. In an effort to use the patient's time efficiently, it is important to schedule appointment according to the patient's individual need. The medical office assistant should discuss in advance with the physician the estimated time frame for certain visit. Periodically, the medical office assistant and the physician should review the scheduling process to determine if adjustment need to be made to better ensure efficient use of time. The following example can be used as a guideline in determining the length of an appointment. New patient, 30 to 45 minutes. Follow-up visit, 10 to 15 minutes. Complete physical, 30 to 60 minutes. Prenatal exam, 30-minute. The above time frame can be utilized as a guide for scheduling appointment. Times will vary depending on the type of practice and the individual physician. The physician may also have a preference regarding when he/she would like new patient schedule or when to schedule a patient for minor procedure. For instance, the physician may want new patient schedule early in the morning, so any wait time is limited. This would leave the patient with a good first impression. If the physician is doing an incision and a drainage of an infected wound, he/she may want that appointment schedule at the end of the day for infection control purposes. The medical office assistant should be knowledgeable of the physician's preference.